Before we begin, this video is for education and inspiration only. It's not medical advice. Be sure to consult a healthcare professional and double-check everything with trusted sources. Hey everyone, welcome back to the channel. Today we're diving into a major player in the world of rheumatology, Cosentyx or secukinumab. If you're a clinician, student, or someone on a treatment journey, this one's for you. We're breaking down how it works, what it treats, and what you need to watch for. So let's start with the basics. Cosentix is a fully human monoclonal antibody, and it belongs to the IL-17A inhibitor class. That means it blocks a specific inflammatory molecule, interleukin-17A, that plays a big role in psoriasis and spondyloarthritis. It's given as a subcutaneous injection and comes in pre-filled syringes or auto-injector pens. Each one contains 150 milligrams per milliliter. Now, what's it used for? Cosentix is FDA approved for several conditions. Moderate to severe plaque psoriasis in patients ages 6 and up. Psoriatic arthritis. Ankylosing spondylitis. Non-Radiographic Axial spondyloarthritis, as long as there's objective inflammation. And in kids 2 and older, it's approved for enthesitis-related arthritis and juvenile psoriatic arthritis. Let's talk dosing. It varies based on the condition. For psoriatic arthritis and axial spondyloarthritis, you usually start with 150 milligrams weekly for 5 weeks, then switch to monthly injections. Some patients may go up to 300 milligrams if needed. For plaque psoriasis, it's 300 milligrams at weeks 0 through 4, then monthly after that. Mechanism time. Cosentix works by neutralizing IL-17A, that key pro-inflammatory cytokine we mentioned earlier. This helps cut down on inflammation, joint pain, enthesitis, dactylitis, and skin lesions. Now for the part we all care about, results. Cosentix has a rapid onset. Patients often start noticing improvements within 1 to 2 weeks. It reduces joint symptoms in both psoriatic arthritis and axial SpA. In psoriasis, it hits impressive PsA 75 and PsA 90 rates. Plus, it shows sustained long-term response. And it helps improve fatigue, quality of life, and how well people function day to day. Of course, there are side effects to know about. Common ones include nasopharyngitis, headache, diarrhea, and upper respiratory infections. But there are some serious or less common risks too. Things like an increased chance of infections, including mucocutaneous candidiasis, hypersensitivity reactions, and the potential for new or worsening inflammatory bowel disease. So what do we monitor? Before starting Cosentix, screen for TB and consider checking for hepatitis. Live vaccines are a no-go during treatment. And if your patient has Crohn's or ulcerative colitis, use caution. Keep an eye out for infections. Watch for signs of new or worsening IBD. And if it's being used with immunosuppressants, check CBC and liver enzymes. Now let's talk about what patients need to know. Store the medication in the fridge and let it come to room temperature before injecting. Rotate those injection sites. Report any infections, GI symptoms, or allergic reactions. And remember, it might take a few weeks to feel full relief. Also, women of childbearing potential should talk to their provider about contraception. Quick comparison time. Cosentix works faster on skin than TNF inhibitors. But if a patient has IBD, it might not be the best choice. For axial disease or psoriatic arthritis with enthesitis, it can be a game changer. And what about cost? Retail is around $5,000 per month. But the good news is, copay programs and prior authorizations often help patients get access. To sum it up, Cosentix is a powerful IL-17A blocker. It targets both joint and skin symptoms with speed and staying power. Just keep an eye on infection risk and GI symptoms. For many, it's a major step forward in managing spondyloarthritic diseases. Thanks for watching. Like, comment, and subscribe for more rheumatology deep dives. And if you found this helpful, hit that like button and share it with your colleagues. Got questions or insights to add? Drop them in the comments below. See you in the next video.